Hello and welcome to the Safety and Quality Education Program podcast. Developed by Metro North Health Safety and Quality in partnership with the Clinical Skills Development Service. Metro North Health acknowledges the traditional custodians of the land upon we live, work and walk, and pay our respects to elders past, present and emerging. The Safety and Quality Education Program has been designed with a focus on patient safety improvement. Each episode will explore ideas and stories in making our care delivery safer for our patients through the implementation of short notice accreditation. Our host is Dr. Mia McLanders, who is the Manager of Research at Clinical Skills Development Service. Mia is an applied researcher with a background in human factors and cognitive psychology. Joining Mia on this episode from Metro North Health is Grant Carey-Ide and Jurina Demaine. Grant Carey-Ide is the Acting Executive Director of Clinical Governance, Safety, Quality and Risk. Grant has an extensive background in safety and quality, senior leadership roles, and is a lead assessor for the NSQHS accreditation. Jurina Demaine, Consumer Representative. Jurina was diagnosed with breast cancer in December 1997. Treated at Caboolture Hospital, she continues as a community liaison with Breast Cancer Network Australia and is a member of Health Consumers Queensland. In this episode, we explore clinical governance and how you, as clinicians, can support robust clinical governance.
And you've been an ACHS accreditor for some time, is that right?
I have for 17 years. It's been a great privilege.
What kind of things have you learned along the way?
That extraordinary solutions can be found to really tricky problems in the most awkward and difficult situations. I have learnt that healthcare providers who work in remote locations face much more tricky situations every day than we who work in metropolitan centres, and are possibly better at finding solutions to those. I've learnt that when we fail to work hand in hand with our consumers, with our patients and their families or those they love, we will fail every time. Mm-hmm. I've learnt that we absolutely need to be on top of what's happening in healthcare so that we can provide the very best care. And I've learnt that amazing things happen in parts of healthcare organisations that we can all become aware of really quickly if we just open the door or open our ears and listen.
I'm really curious to hear about what some of those more creative solutions are. Is there anything that kind of pops into your mind when you think about creative solutions to complex problems in healthcare?
I think it's always about being pragmatic. I think the bigger the organisation, the more likely we are to have layers and layers of bureaucracy wrapped around trying to find a solution and certainly to implementing a solution. Whereas if you're in a remote island in the Torres Strait, as an example, and it's cyclone season, and you're the only healthcare provider working on one of those islands, you're it. And you have to find the solution. There's no layers of bureaucracy. And the health and the outcomes of the healthcare for an individual person are in your hands. And there's no policy necessarily to guide you. You can't actually communicate with someone because of the cyclone. No one's coming to help you because of the cyclone. You have to find the answer for yourself. And so people, I think, fall back into, well, what am I trained to do? And what is that training telling me to do now? And how can I actually apply that to this situation? And they do. And they do it beautifully. And it's always patient-focused.
So the clinical governance standard, though, is around policy and procedure and the maintenance of, I would guess some people would see it as that bureaucracy that you're describing. So how do you reconcile that then?
I don't have any problem reconciling that because
I
don't agree with that.
You don't agree?
No.
Tell me.
The clinical governance standard is about putting in place frameworks for all of us to provide safe and quality healthcare every day. It embraces a whole heap of different principles. So part of it is about policy and procedure frameworks, and that stuff is important. You don't always have it to depend on, but it is important because it reflects what contemporary practice actually looks like. It will reflect the values and the principles of the organisation that you work for. It will represent safe practice, and that's really important for a patient, for their families, for us as well as health professionals. But it also encompasses things like making sure that the environment in which we provide healthcare and the equipment that we've got to support us to provide it is safe and that it works well, and that protects patients, it protects us. It means we all go home safe at the end of the day. It means that we are able to put in place a learning culture in our organisation, a restorative and just culture that says we are human and we will make mistakes. But from those mistakes, we will learn. It embraces principles around health equity, with some of the actions included in the clinical governance standard relating to the environment that we create for our First Nations people in healthcare. For the welcome, the genuine welcome that we actually provide for First Nations people and their families, and that we recognise that health equity is a thing that we must do. It's not an option for us. So there's a whole heap of different principles that I don't think are about bureaucracy. The bureaucracy will actually make those things happen. Bureaucracies are necessary, but they should not be the guiding principle. The voice of the consumer and the quality of the care that we provide to consumers is actually what underpins Standard 1.
Amazing. I think I'm converted. Jurina, what do you think about what Grant's just said there? What is your experience of going into a clinical environment where you've observed that there is good, strong adherence to the clinical governance frameworks versus maybe an environment where you're not so sure that that's happening?
Well, I think from a consumer perspective, what we really need is to understand what's going to happen to us, why it's going to happen, and what we need to do to help it happen, because we're not just something on the slab, we're not there yet. So the patient is as much a part of the team as the whole medical service.
So, and you've had those experiences where you feel that way, that you are part of...
That I am part of it. Team. Definitely lately, yes. I've got a brilliant GP. Within the system now, I find, I can... When I talk to surgeons, professors or whatever, or board chair members, I just have as much right to anything as they do. And they appreciate that and understand that. And they're willing to work with me rather than for me or at me, so...
I can recall instances where people have not complied with policy or not complied with procedures because the system has let those people down. So I don't think any health professional or any of the really important support services that make it possible for health professionals to do their work every day get out of bed and come to work wanting to do the wrong thing, ever. I don't believe that. What I believe is that the system sometimes lets people down in the work that they do by not making sure that they know about policies and procedures or that they know about changes to them, or not providing a culture that actually says it's okay that you made a mistake, but let me work with you to understand where you made that mistake and what it is that you need to do differently.
Kind of comes back to what you were saying earlier about the restorative just culture. And can you talk to me a little bit more about that?
When we're talking about a restorative just culture in terms of incident reporting, it's because we genuinely want to understand where our systems are failing. We're not out to hunt down individuals. We're out to understand the points of failure in our health service delivery and the opportunities, therefore, for improvement. And we learn so much from the fact that all our staff take the time every day to actually tell us about things that have not had the outcome we wanted them to have. And sometimes they're near misses where the incident didn't actually reach a patient, and they're just as important for us to learn about, because often it is that our systems have let someone down.
As an accreditor, when you're walking into that clinical environment, so if we see you coming, what are the kind of questions that we can expect to hear, and what are the things that will typically kind of catch people unawares?
Oh, look, the first thing I'd say to everyone is please don't run. We are, all of us are healthcare professionals. So we're either still practicing in healthcare, or we've actually only very recently left the direct service provision. So we actually understand, we're pragmatic and we're sensible people. But what we'll ask questions about are things about how do the systems work to support you. So, you know, I might talk to someone firstly about how's their day going, and people will tell me how their day's going. And I might ask them to tell me about the patients that they're actually looking after today, if that's what they do in the organisation. Or I might ask a wardie to tell me about how the work that they do supports patient care. So there's lots of different examples, but in that conversation, people give you clues. And so the clues might lead me to ask someone about, so where would you find a policy about that illness that you've just told me, or a procedure? Or if you weren't sure what the treatment was for that particular illness, where would you go to actually find that? And of course, I want people to tell me things like QEPS would be a place, or I might look up a clinical pathway.
Yeah.
And then I might ask them to show me where they would do that. I'm really hoping no one will ever show me hard copy because we don't do hard copy across Queensland Health. I want them to show me on the computer where they would go to. But one of the other really important things is I want people to say, honestly, well, actually, I'm not sure. But what I'd do is I'd ask my line manager if I don't know about QEPS. So we really want people to be honest, but what we're actually really looking for is that people will practice safely. So people will say things like, I'm not really sure, but when I'm not sure, I go to my line manager.
Yeah, perfect. That sounds quite achievable.
Very achievable.
Is there anything that you feel that today we haven't covered? Anything you want to add?
I don't think there is. I think understanding that it's important to have systems in place to support our health professionals and support staff to provide the best care is a really important thing. I think Jurina has made probably the most important point, which is about nothing about me without me, hand in hand with our patients. And that covers every single standard. We really should be very focused on that every day. And if we come to work with that focus in our mind, we're not really going to get much wrong. I don't think that patients do need to know about the standards, particularly unless they're really interested in them. I think patients want to know that they can trust us, that we are guided by good principles, by really good governance, and that the care they're going to receive is the safest and the best care that they can when they trust us to provide it.
Thank you.
Yeah, they really need to feel safe. That's really what's, because they always come in frightened. Imagine, if all the clinicians imagine that this is their own wife, child, mother or father, uncle or auntie, cousin, whatever, how will they treat that person? And how do they want to see that person treated?
Yeah.